Thank you, Chairman Pallone. I appreciate this subcommittee remaining active, but I currently continue to be disappointed that we aren't holding hearings on the implementation of the new health reform law. In my district, people aren't asking about if a healthy earth means healthier humans or if smokeless tobacco is bad for children. We know it is. People are asking questions on what we have read and being reported on the changes that will come now and in the future with the new health reform law. So why aren't we doing follow-up? Was there a drafting error so children with pre-existing conditions are not going to be receiving coverage immediately as possible? Is it true those currently in high-risk insurance pools will be stuck paying higher premiums because they don't qualify for the new high-risk pools? Do they really need to be uninsured for 6 months to receive this coverage? If families with low wages are dumped into Medicaid because their employer opts to pay for coverage through the state exchanges, will they have access to the same coverage as those in the exchange? Can they see the same doctors? For those, these are all questions that people are asking, and the questions that are being reported in the media. How about this one? For those in the individual market, are their premiums going to rise on average of $2,100 as stated by the CBO and reported in a recent New York Times article? The health reform law says penalties will occur if you don't have insurance coverage for at least 3 months in the year. Can someone cancel their coverage after 3 months and 1 day and then wait until they get sick to repurchase coverage? Will that mean increases in insurance premiums for those who play fair? Are small businesses going to be able to afford to provide health insurance? Is just 12% of the small business population going to benefit in any way from the tax credits as reported by the CBO? Is it true that firms with more than 25 employees will get no tax credit at all? And for those few that qualify, if the credit is only available for 6 years, how do they afford health care costs beyond them in the future years? These are the questions my constituents are asking and questions we as members of the Health Subcommittee should be addressing, because some of these problems we can fix now. We can pass a bill and rectify some of these problems we already know that exist on this health care bill. We were supposed to have Caterpillar, AT&T, and others in front of the O&I subcommittee to discuss their financial disclosures and burdens. Last week, that hearing was quietly canceled. Then next week, this subcommittee was going to address Medicare and Medicaid fraud. That has now been postponed. Chairman Pallone, I really do want to work with you on evaluating those provisions that we know are bad in this bill that we can fix. I know we're going to have numerous hearings on health care issues. I'm here to represent my constituents of the 19th District in Illinois, and there's a high level of fear out there of the unknown. And I think our committee could do well in getting some of these questions answered. And with that,
will the gentleman yield?
I would yield.
When you mentioned that the O&I subcommittee was canceled, was that canceled? The point of that hearing was it because these corporations were out there, they were talking about what they were going to have to mark down because of their cost and the accounting practices, and they were going to challenge them. And as it's turned out, what the companies were saying was absolutely true. Under the accounting practices, they are required as a public company to disclose as soon as they learn what their liability is, that they must mark that down in that quarter. And so all of these publicly traded companies who quickly did an assessment of what the cost would be, billions of dollars now are being marked down against earnings in this quarter. Is that not correct?
That's correct. A lot of these were announced after the passage of the bill. I used actually one of these companies, which was Caterpillar, on the floor prior to the vote to talk about the cost that would incur. And I think the goal was to bring these CEO captains of industry in here and embarrass them. And I think what is the truth is they were just following the SEC code.
Well, John, further yield?
I would.
I noticed this week Eli Lilly, which is a very strong corporate partner even in Indiana, had to mark down their earnings around 11 or 12 cents, and companies all over the country. So when they talked about the cost of this health care bill to carry that burden, in fact, it's true. It was a reality. So instead of facing the embarrassment, the Democrat majority canceled that. Is that not correct?
Well, you'd have to talk to Chairman Waxman as far as his intent, but I do know it was scheduled and it was canceled.
Thank you.
And I yield back my time. Thank you, Mr. Chairman.